How does one use information in the Cochrane Reviews to communicate with healthcare providers and make healthcare decisions? Today, we are looking at using Cochrane Reviews in real life. I would like to thank everyone for joining us for the webinar, but I'd also like to thank the funders of Cochrane Canada, without whom these webinars, our training, systematic reviews, and capacity building could not happen. Thank you to CIHR and their institutes for their support. We'd also like to acknowledge the Ontario Ministry of Health and Long-Term Care for their support. PAHO has kindly provided the Blackboard software for our webinars. And a special thank you goes to Luis Gabriel Cuervo, who converts our webinars to YouTube videos, which are then, as I mentioned, in our archives on the Canadian Cochrane Centre website. Without further ado, I'd like to introduce today's webinar presenter, Anne Lydiot. Anne has a healthcare background, but admits she didn't know about Cochrane until about 12 years ago, when a friend invited her to a Cochrane Canada symposium. Over the next couple of years, she learned more about the Cochrane collaboration and systematic reviews. She began to volunteer as a consumer, which she found both interesting and rewarding. She was able to contribute her perspective as a consumer on reviews and protocols, which gave her a much better knowledge of available treatments. She states this knowledge has made a valuable contribution to her decisions when options for treatment or care were presented. Anne believes Cochrane Reviews are a trustworthy, easily accessible resource that everyone should know about and use. Over the years, Anne has served on many committees. Presently, she is involved with CIHR's SPORE, or Strategy for Patient-Oriented Research, National Steering Committee. She is also the co-chair of the Cochrane Consumer Network and a member of the Cochrane Steering Group. She has also been recognized for her contributions, receiving the Queen's Diamond Jubilee Medal. We are pleased to have you here today, Anne, so please go ahead.
Good morning. I guess it's really afternoon, everyone. Excuse me. It's great to be online. I think I've done a lot of speaking to groups, but never on the computer, taking part in webinars, but not speaking. So I think I prefer to face my audience rather than my computer screen. However, let's get started. And one of the first things I'd like to know, and I think Eileen asked this before, was using reviews to make healthcare decisions. And I think the poll did come up, but if you could just refresh my memory here, how many of you have used them? Good. Okay. So there's been some that do most of the time sometimes, but some haven't used them at all. So that's fine. We'll go through this, and maybe you'll be a little more familiar with them, I hope, at the end of the session, what the resources are and how you can access them. So a reality bites, and that's so true. It's being a patient for a number of years with a chronic disease, I think that all of us, it's somewhat like an accident. It's always going to happen to someone else, never to us. And when you're diagnosed with something that is going to interrupt your life and make you a patient rather than a person, because none of us class ourselves as patients in reality, it's a real difference in your life. So all of a sudden you or a family member or friend has been prescribed a new and unfamiliar treatment by your practitioner. So you leave the appointment and you're standing there kind of wondering, well, now what? What do I do now? And this slide with too much information equals overload and confusion, I think is really, really true. The printing on the slide that you can read obviously shows you the amount of material that professionals are bombarded with on a daily, weekly, monthly basis. And this is also true with consumers, because when you think of the information that we get, it's printed material. You can't pick up a magazine without something about healthcare or treatments. It's on the TV all the time, and most of Canada is receiving the American ads for medication, so we're subjected to that all the time. And I think that most of us, if we're honest, will confess that one of our quote, doctors, unquote, is Dr. Google. Excuse me, because we all tend to, when we have a question, go to Google. So a lot of that information is there, along with the input that we get from family and friends with their advice and cures that they offer. And so it does lead to a lot of confusion about what do I do next, or who do I believe, who do I trust, how do I make a decision about what I want to do here? Do I really want to take this medication or do this treatment? So one of the things we cry out for, of course, is help. Help that we can rely on. So what is a systematic review? Well, it's reliable evidence that's been distilled or synthesized into a compact amount of information that gives you a full picture of the question that you're facing. And why should they be used? To help you make a decision so that you know the facts and what is available, what's good, what's bad, the pluses, the minuses. So this is a diagram of a systematic review, how it's done. And you can see, I like this one because of the funnel aspect. So it shows the studies going in. Now remember that the studies going into a systematic review are primary studies. And while in this diagram, you're seeing all of the studies going into the funnel, in reality, someone doing a systematic review, the authors probably wouldn't put all the studies in, and rather than seeing all of them drop into the funnel, some of those would be falling off to the side, somewhat like myself when I use a funnel and I get a little over exuberant and whatever I'm trying to funnel into a container lands on the counter. But if the studies don't meet the strict criteria, then they don't go into the systematic review process. And those are all set up before it started, these strict, what studies they will take and what studies they won't take. So the studies that go into that are funneled through, and the information will go through this process a little bit more, are gone through a rigorous process. And then you have the systematic review from out the other end, and it's publicized into or it's synthesized, into a new publication. The interesting thing on this process is, as well as the studies going in and going through the process, throughout that process, there's input from peers and from consumers all the way through, right from the beginning of the process on through. So this next slide is a little bit more about information, and we know that there's a lot of information out there. It starts at the bottom with the background information, expert opinion. And this doesn't mean it isn't good, but as you go up the triangle here, you'll see that systematic reviews are at the top. So expert opinion is probably going to come from people who are obviously familiar with the subject and have their own opinion on it, but it hasn't been tested, filtered information. And you see as it goes up, and most of you on the call will be familiar with some of these things, the cohort studies of the RCTs or randomized control trials. So the further up you go, the more filtered the information becomes and the better the quality of the evidence. And you can see that at the top of this pyramid are the systematic reviews, because they've gone through all of these controls and filters to make sure that the information that's in the review is the most accurate and reliable. And this is a screenshot, an example of a review available on the Cochrane Library with the Cochrane Library address. Some of you will have access to full reviews if you're associated with a university or a hospital that has access, or if you live in one of the provinces that has access. The reviews are divided into sections, so you have the full review, which can be quite lengthy. Some of them that had come through have been close to 100 pages. That information often is distilled down, well, it is when it's published, into what we call an abstract. And the abstract is a smaller version, so it follows the same headings as the main part of the review, but condenses the information down, usually into about 2 pages. And then there's another section that's even more condensed, and that's the plain language summary, which we refer to always as the PLS. And that's something that is specifically for consumers. Abstracts are often also read by consumers, and abstracts are usually the go-to item for practitioners, just because of the time element. You can imagine if you wanted to read a review and you had a limited amount of time and you brought it up and it was 70 to 100 pages, you're not going to have time for that. So practitioners often use the abstract as well. And we'll often look at the plain language summary too to see what their patients are reading. The plain language summary that you see here has headings. This is one from the MSK group, and it has a background information and then the different headings that you will follow in a review. When you find plain language summaries from different groups, they won't all follow the same format. They'll all contain the same information, but some of them will only be in paragraph form. So once you're familiar with the form of a plain language summary, then you'll see that the information is in there, but they just follow different formats. So once you've read a review, the abstract or the plain language summary, sometimes you still, you have questions. You're still not sure this is what you want to do or to take. And I think that all of us have been in that position at one point or another, that we're not really sure whether we want to go down that road. We've got questions about the whole treatment and whether we want to get into that, whether that is really for us, or in some cases whether we can afford it. So one of the things that has been developed of patient decision aids, and these can be really helpful to help patients come to a conclusion about the treatment that's ordered. And as it says here, there are tools that help people become involved in decision making by making explicit or clear the decision that needs to be made. So it gives options about what information about the options that are available and the outcome. And I think an important feature of the decision aids is clarifying the personal value so that people go through them, and what's really important to me might not be really important to my neighbor or a relative in terms of making this decision. And different things come into play when you're thinking about something. It's the fact that, how long do I have to take this medication? What are the side effects or possible harms from it? A lot of people are maybe more concerned about that than, what is this going to do for me? The cost can be a huge factor that people want to know about and think about when they make their decision, if they have insurance or coverage or they don't have it. So a lot of things can come into play when people are trying to make a decision, and even if it's something that your gut tells you this is probably what I should be doing, sometimes you still aren't sure, and you've left the doctor's office and you have all these questions swirling around in your head, and you've got a prescription in your hand, and your next appointment is 2 months down the road. So you're wondering just what do I do? So hopefully by that point you have gone and read something about it on the abstract or the plain language summary to consumer, and that's helped you a little bit, but now you have to make a choice, and this is where the decision aids can be helpful when you're not sure what way you want to go or what you want to do. And you see the link at the bottom gives you access to decision aids, and this is a slide of telling you more about what decision aids are and how you can find them and how to use them. And another thing that I didn't mention that has recently come on, and you'll get a link to it later in the webinar, is the Cochrane summaries. And they're similar to a plain language summary, that they summarize the evidence. And I just, for interest's sake, went on them this morning, and I saw that quite a few more had been added from the last time I was on. So all of these things for right now, I was interested because everybody's walking around with a cold and complaining about it, and there was an interesting one on there about vitamin C for cold. So it's not just major medical decisions, but things that we all encounter every day that you can find information in Cochrane, and then if you make a decision aid, use a decision aid if you want to make a decision about what you want to do. And the A to Z inventory is really helpful because you can just scan through there, and quite often you'll find stuff that, oh, gee, I was wondering about that, and it's maybe gone to the back of your mind, you hadn't thought about it for a while, or you said, oh, so-and-so asked me about that. Then you can read it and you can direct them to the site. So there's a lot of things listed there that can be really helpful to get into and read. So this shot, anyway, the previous shot showed you the alphabetical index that you can access through the site. And as I said, that one, it can be really helpful to go through and just to know what is available. Now, this one, for people that aren't used to using a decision aid or who have never used it, this guide can be really helpful. It's exactly that. It's a guide for how you go through the decision aid. Talking about what decision you want to make, so helping you to clarify the question and why you need to make the decision, and when do you need to. Is this something that's urgent, or can you think about it for a bit? Can you gather more information? And where are you in making this choice? Then under the exploring it, you go through knowledge, values, and your certainty. So the knowledge, most of the decision aids have a little bit of information at the top about the condition or the decision that you're going to make. And if not, then I would say go back to the plain language summary and check that so that you're familiar with what it is, and you know the background for the condition or the medication or whatever it is that you're making a decision on. And the values, I spoke of that a little earlier, is we all have different values and place different amounts of importance on the various parts of the decision. So the parts that matter and are really important to me may not be to someone else in my family or friends or neighbors. And this is where patients need to know that there's not right or wrong answers in the decision aids. They need to answer it honestly so that they can make the decision that's right for them. Or sometimes they get to the end of it and they still aren't sure, and that's fine too, because usually what's happened there is it's clarified in their mind the areas that they need more. They need a little more information, or they want to know a little bit more. They want to check with their practitioner something more either about the condition or the treatment. And that's helpful to the practitioner because it's time-saving. Often when faced with the decision aid, that's one of the barriers to use with them, that practitioners are concerned about the amount of time they take. But if the patient is guided to them and uses them at home, first of all, it's a time saver. Second, if they need help with it, they usually have a family member there or someone that they can ask to help them with it, to get through it. And it will help them for the information that they still need or want to know, to jot it down in 1 or 2 questions so that when they see the doctor or practitioner the next time, they can ask and they can clarify those 2 items that are of concern. And for those of you on the call that aren't practitioners, you've probably had the scenario where you've seen a patient and sent them out with either prescription for medication or instructions to go for treatment, whether it's physio or to see a dietitian or something, and you see them 2 months later and they still haven't done anything because they couldn't make up their mind or they had questions about it. So having them know exactly what information they need and want to make the decision is really helpful. So guiding your patients to these sites to use them can be valuable to you as well as to them. The other thing is that when they finish this, you obviously have a more informed, educated patient. They know more about their disease, they know more about the treatment and the options, and sometimes they'll come back and say, well, when I was reading, there was this option that was available. Why isn't that suitable for me, or why didn't you offer that to me or suggest it? Having them take part in this and understand it can make a big difference in adherence. Adherence in chronic conditions can be problematic. We all know that, and as a patient with chronic disease, I can certainly attest to that, you tend to fall off the wagon for adherence once in a while, and knowing why you have to do this stuff and when, and the importance of it can be really important. If you don't understand it, the impetus to do it is not there as much. Most of the things, particularly the plain language summary, is written at a level to be understood. If they try to get them at a grade 6 reading level, and that will suit the majority of the population. However, keep in mind that people with comprehension or literacy problems may need help with it, or if English is a second language. And certainly with the decision aids, those are things to keep in mind, that your patients may need some help if, as I say, there's comprehension or literacy problems or health literacy problems. Maybe they're able to read very well, but they're not at all literate in health issues. They've never had health problems. Maybe they've never been to a hospital. Maybe they've seen a doctor a couple of times in their life for a physical, and that's been it. And all of a sudden they're hit with something that is going to require ongoing care. So keeping those things in mind when you refer them, and making sure that if they don't have someone at home to help them with this stuff, that you make arrangements that someone in your office, or that you can book an appointment and make time to go through these with them. And this slide is done by the musculoskeletal group, and their decision aids, they put this on for information about what is available through their group. And they've done a lot of work on the decision aids, and you'll find quite a few available in their site. They certainly, it's an ongoing thing. They're updated. One of the things that you should know about the decision aids, if you're not familiar with them, is that we talked about the reviews having a strict process, and a methodology that they have to follow, so that they're very rigid, and the authors have to go through this set process. It's the same thing when decision aids are developed, and there's an international group that sets the guidelines, and they meet yearly, and you'll see if you start to look into decision aids, you'll see information on this. It's the international. I know the acronym. It's IPDAS, International Patient Decision Aid Standards, and so all of the decision aids go through. The standards that group sets. So again, you can rely on them to be accurate. So I'm just going to go quickly through this example for a decision aid so that you can see what's involved, and hopefully we'll have time if there's any questions at the end. But you can see on this one, it's one of the ones for a chronic disease, common hip or knee osteoarthritis. So all of us know someone with this, or have a friend or a neighbor or family member, or maybe have it yourself. And you can see the little blurb at the top gives a bit of background on what osteoarthritis is. And then it goes into how it's affecting the patient, and over the past week, about their pain and how it's affected their day-to-day activities. What have they had difficulty with? What has become problematic? It's good for people to go through this, because when, particularly when something is a chronic disease, after a while you don't really pay attention to this. So having the patient read this and score it is good. And again, there isn't a right or wrong answer. It's what's going on in their life. And then this carries on with other activities of daily living, as well as what you're doing to manage their osteoarthritis at the current time. And you can see that it goes at the different levels there. So quite often people haven't really tried anything, or they've tried maybe the Level 2 is quite common, because a lot of people will take acetaminophen for it before they even do the exercise or weight control. So going through all of these things, again, helps them to determine what there is available, what they've tried, what they haven't tried, what their doctor's ordered, and also how often they follow their regime. And this, of course, is really important when they're on medication, or if they are trying to do an exercise program or a weight control. So, are they really adherent to this? And then ask them what are their options. Like, what do they want to do now? Do they want to change or not? And some people, they're just not ready for it yet. Maybe it isn't bothering them enough, or maybe they're willing to cope with it. Again, people have different reasons for their decisions, and as I said, it's individual, so each person has to answer it according to where they are and their own personal feelings on it and what they want to do. The benefits and harms of each option, as they go through the decision aid, they're listed, and you can see on the form here the graph. So it goes from the levels 1 through to the 5, and the little smiley faces are really quite helpful to people, because it shows them the number that do and don't improve from the intervention or the treatment. And this can be helpful for them to see and to know. And it also tells them the harms and side effects. So as you get down into the higher levels, you'll see that then the harms or side effects come more into play. And they're done in the same format with the graph so that people can see just visually the number that improve versus the ones that don't improve. And sometimes that visual is really helpful to people. So this is their personal values and more how things, what's important to them and how important it is. And some people, you know, better pain relief, that may be really important to one person, but to another person, it's not important at all. When you talk about prescription pills, it goes back, as I mentioned earlier, there's a lot of things that come into play here. That may depend on what the pill is, the side effects that are possible from the pill, how much does it cost? And for people who don't have coverage, that can be a huge factor, along with how long do I have to take this? Do I have to take this for the rest of my life? To avoid needles, and some people are absolutely terrified of needles, and that's a huge concern. They'd do anything to avoid taking needles or having needles. So those can be, again, things that people have to answer from a personal level. And the serious harms, bleeding ulcers or heart attacks, again, you know, obviously most people are going to want to avoid the serious harms, and that, but if they are really in difficulty, that may be, they may look at the level of risk and say, well, I'm willing to tolerate that level of risk to get better pain relief. So it's checks and balances for what works for each individual. And this slide shows you, it's kind of a check or a review for the patient to see if they've really understood the information that they've been reading and interpreted it correctly. So it's a review or a question list, and if they don't understand it, then they can go back, or this may be where they figure out what they need to find out more on their next appointment, because they really don't understand what this is about. And again, they should know that if you don't understand this, then write down your question, and the next time you're going to see your practitioner, then ask about this. And the last question, of course, was how comfortable you feel about deciding, and it clarifies for each person about the benefits and harms, whether they've had enough support and advice to make their decision, and what they feel is the best for them, and then their next steps. So maybe they're still not sure and they don't want to make a change. Maybe they do want to make a change, and then how motivated and confident they are. And again, this goes back to adherence, because the more motivated they are and confident, the more they're allowed to be adherent to the program. So we've talked about the reviews, the abstracts, plain language summaries, the summaries themselves, and the different decision aids that are available through the sites that are listed here. The Cochrane Library, as I said, some of you will have access to the full library with the full reviews. Some of you will just be able to get abstracts, plain language summaries. The Cochrane summaries, if you just try that link, it will take you right to them, and there's a long list of them. And even if you're not looking for something specific, I would suggest that you go into both the library and the summaries and take a look, because even if you don't have a question right now, it's interesting to know what's on there, and when you're questioned by friends or family, you know when you can direct them to the site and say, I saw something on what you're asking me about, and if you go there and read about it, the decision aids, both the musculoskeletal group and the ones from the Ottawa Hospital. The Ottawa Hospital ones are the ones that we saw on the slide with the long alphabetical list that's easy for people to scan through. And then the musculoskeletal group obviously is more geared toward the musculoskeletal condition. So anything that group would cover, you'll find the decision aids that are available in there. When people are looking for these, I think almost all of us, if we're honest, will confess that we all use Dr. Google to find things. That's fine. It will still get you to the library, to the summaries, or to the decision aids. But if you're not familiar with it, or if you're directing a patient, or you feel that your patient is going to Google to get these, make sure that they know how to identify the reliable information, because they will, the sites that we have listed here will come up, but there will also be some commercial sites or some sites that aren't as reliable, that the evidence is not like Cochrane evidence. So next week the webinar will cover how you can make sure that you're getting reliable information, but I think that it's wise just to keep that in mind when you direct people there, that be aware that people will use that as a resource, and they're exposed to a lot of these things through television and magazines. So make sure that they know the reliable resources to go to. So thank you very much. I think that Eileen has some slides that she wants to go through.
Thank you very much, Anne, for your presentation. Hopefully this has broadened everybody's knowledge about the resources out there when it comes to making healthcare decisions. Now, if anybody has any questions, please send them through the chat room at the bottom, and we'll get Anne to speak to your questions.
What is the difference between a systematic review and meta-analysis?
Okay, a systematic review, and now I'm not a methodologist, be aware, I'm a consumer, so if I get this wrong, hopefully someone will jump in and help me out here. The systematic review takes primary studies. If you think back to the slide where we had the funnel and all the studies were going in and then coming out in a systematic review. So quite often on one topic you'll get several systematic reviews on one question. So then when they do a meta-analysis, they put all those through and do a large review on the whole question with all of the reviews, and put it all together and bring that information through the process again.
Yes, it is an analysis based on that. You know, the outcomes being the same.
Right.
Oftentimes, if the outcomes measured are different in different studies, that's when you cannot do a meta-analysis, because it's really comparing, you know, apples and oranges.
Yes. Yeah. So one of the recent meta-analysis that I can think of, and you may think of other ones, Eileen, was the biologic drugs which have come into use in the last 15 years for rheumatoid arthritis and Crohn's disease and some of the other inflammatory conditions. There was several reviews on that, and they were brought together into a meta-analysis. I'm trying to think of what other ones came through, and that's the only one I can think of offhand. Can you think of others, Eileen?
Not offhand, but they usually do require a certain minimum number of studies that actually have the same outcome, and you know, whether it's 4, whether it's 7, to do that meta-analysis to really be meaningful.
Yeah.
And how often are the decision aids updated? Kent has said he noticed a 2000 copyright on some of the samples.
I don't know the specific timeline, but I thought on the IPDAS site when I was checking through there, I thought that they were something like the reviews, that if there was any changes, they were updated or they were checked about every 3 years. So I would gather that from what I've read, and I'm only involved with decision aids from the musculoskeletal group, and I know that they review theirs probably every 2 to 3 years, or when there's something different that comes through. But I don't know what the standards are internationally. So I'm surprised that there's one that was from 2000. Most of them are really quite current.
We have a question from Kelly. The decision aids would be a great resource for public libraries to know about for patrons with health questions. Is it appropriate to provide these to them?
The librarians all have the information on Cochrane. I guess it depends on their own interest and whether they retain that information. But I know that I was at a launch for the library back 3 or 4 years ago, and the woman who at that point was the head of the Library Association or Librarians Association, I'm not sure what they were called, but anyway, she was there, and the public libraries do know about Cochrane, but I would think that probably the level of knowledge and interest in it varies, so I'm not going to guarantee that every library you go into is going to send you to Cochrane. I agree, it is a valuable spot. And as consumers, those of us in Cochrane often spend some of our time delivering information to libraries and leaving it with them and promoting Cochrane, both the abstracts, the summaries, and the plain language summaries, as well as the decision aids, so that they remember to give it to patrons. So I agree, it's a great resource and one we should use more, get them to use it more. Another place that people take a lot of their health questions and that we concentrate on getting them to use Cochrane is pharmacists, because people, particularly when it comes to medications, people will often ask their pharmacist, even before they ask their practitioner, they'll ask the pharmacist about their medication. So we try, each of us, to make sure that this is something that the pharmacists use and refer the patients to as a reliable resource and to help them make a decision.
Yes, we really do need, I guess, advocates and champions out there. I know that we do speak to the Canadian Health Libraries Association and the Ontario Health Libraries Association, and just libraries in general. But it's a matter of getting the word out there and getting it at sort of the forefront of the knowledge, so that when people come in, that they can really, let's say, the librarians can refer them to these sites.
This is something that I've been kind of passionate about for a few years, and that's developing something that we can take out. And I know that Eileen has been doing a lot of work on this too, and it's what we call a canned presentation to inform these different groups. So librarians, if you have let's say a county branch, I'm not sure just how they're divided, because I live in a small community and it's a small library, so I can go and talk to them. But geographically, I know they meet, so reminding them and refreshing them about the library and the decision aids and what's available. and speaking to groups that meet, and advertising in magazines. We see all kinds of advertisements for medications and that in magazines and for health aids, but we don't see much about helping people to get reliable information. I think this is something that we really have to work on. It becomes even more important now, I think, when there's so much information, as I said, that we're bombarded with in magazines and media, and particularly on the television, receiving the American channels and that. I've had at least 2 emails in the last week from patients who saw ads for medication on an American station and were wondering about it. So it's just things that we know are part of everyday life. So how do we get people to go to the right source for the information?
Okay, well, thank you very much, everyone, for joining us today, and we really appreciate your time and participation. And thank you very much, Anne, for presenting.
Thank you, everybody.